I'm going to get us started. We've started recording. Um, we will first share a couple of announcements with you of some upcoming events. And then we're going to hear from Dr. Elizabeth McGuire about teamwork and implementation outcomes, findings and recommendations from a systematic review that was published a few years ago. So we're excited to hear from Dr. McGuire. So why don't we go to our next slide here? And thanks everyone. Continue to introduce yourself in the chat. It's nice to see who's here. So we are excited to announce that next month in our disc seminar, we'll be hearing from our very own Dr. Brooklyn Frazee and Dr. Anna Lau from UCLA. And they'll be sharing about the effectiveness of multi-level implementation strategies for autism interventions, outcomes from two linked implementation trials. So this is a not miss presentation. There's going to be Kara has already included the link in the chat to register for our upcoming seminars. So please join us March 20th at 2 p.m. Pacific. Okay, next slide, Kara. A few other announcements we wanted to share. So our InStep Children's Mental Health Center has pilot funding available. We have an open call for applications. The deadline is March 1st at noon Pacific. And the purpose of these pilot awards, which are 1 year, up to $50,000, the purpose is to support pilot feasibility studies that leverage our InStep Center resources to pursue innovative proof of concept studies, again, that really focus on advancing team effectiveness, implementation science, and children's mental health services research. You can learn more at the link that Kara will share in the chat. We also wanted to share that in next month's adaptation, fidelity, and tailoring workgroup meeting, we will be hearing from Candice Black Dr. Candice Black on hybrid type 2 implementation effectiveness, a trial of a play collaborative implementation strategy in Rwanda. And you can find out more information about how to become a member of the Adaptation, Fidelity, and Tailoring Workgroup meeting in the chat and to register for that talk. And then finally, the DISC is continuing to host EPIS office hours. So EPIS, for those who are new to us here, is the Exploration, Preparation, Implementation, Sustainment model, one of the leading implementation science frameworks. And I believe, and Greg is, Dr. Ahrens is on the call, there are two sessions monthly, one in the morning from 8 to 9, and one in the afternoons from 4 to 5 p.m. And I believe Dr. Ahrens and Dr. Erica Crable, an EPIS super user, host those sessions. I think they have been very well attended from both domestic and international investigators. So if you're interested to join one of those sessions, please register in the link in the chat. And I think with that, I'll go ahead and introduce Dr. Elizabeth McGuire, who is our presenter today. So Dr. McGuire is an assistant professor of psychiatry and pediatrics at the University of Pittsburgh. Her research aims to improve mental health outcomes for children who experience maltreatment through better implementation of evidence-based practices and expansion of mental health services into non-traditional settings. Areas of her expertise include implementation science, teamwork, child maltreatment, and children's mental health services. She's currently supported by a career development award that she's leading from the National Institute of Mental Health to examine how teamwork affects implementation in multidisciplinary team-based service settings. And so with that, we will pass it over to you, Dr. McGuire. Really excited to learn from you today.
Awesome. Thank you for the introduction. Excited to be here. Okay, are my slides showing correctly?
Yes, and they're beautiful. I love the little pinwheels.
Yes, those are blue pinwheels for child abuse prevention, which is not till April, but I put them on a slide once and then decided I just liked the way they looked. So excited to talk with y'all today. Let's see if I can get my arrows working. There we go. Okay, so our agenda, I'm going to talk a little bit about teams and implementation science just to give some background. Then talk about the findings from the systematic review that was published, I think, just last summer, and then some recommendations for implementation research with teams. So systematic reviews are a giant project. So lots of people contributed to this. And I think all the co-authors that are listed here, as well as all the research assistants who helped with the screening articles and all the other work that goes into making one of these happen. I don't have any conflicts of interest, but this work was supported by a few different grants from the National Institutes of Mental Health, as well as funding from the Agency for Healthcare Research and Quality, and a grant or a lab at Carnegie Mellon. So this first part, just to give a little background on teams and implementation science, I think I've probably said some of this to this group before, so I'm going to go through it quickly, but I also am always happy to discuss this topic if there are questions along the way. So we all know that implementation science is about trying to bridge this gap between research and practice. We want this really sturdy, well-constructed bridge, but we really don't have that. Lots of things we need to figure out, and we've built lots of theories, models, and frameworks to help us do that. What they all have in common is that context matters. So we know that implementation is this dynamic process that unfolds over time across different levels. All these different levels influence how implementation happens. And usually when we think about different levels of influence and barriers and facilitators, we're thinking about clients that are nested within providers who work within organizations that are part of larger systems. It's not always quite that straightforward, though. And so one level that I think has been kind of missed a lot is the team level. So sometimes providers are working within teams, especially in healthcare, they're working within a team to deliver services to patients. And when services are provided by a team, the whole team has to make changes in what they do and how they do it if you want to make something new happen. But we haven't paid as much attention to what is happening at the team level and how teamwork might influence implementation processes and outcomes. So when we think about teams and implementation science, there's lots of different types of teams that are relevant. So I think the first one listed here has probably received the most attention, and these are implementation support teams. And so this is when you are trying to implement something and you've got a group of people together. This is your change team or the people who are going to work together to make this happen in the setting. So the kind of shared responsibility here is to make this new thing happen. They might be within an organization or across different organizations or systems. Often membership is voluntary, so people, volunteer to join this team to make this happen. And it's typically time limited, so it's usually we're putting this team together to get this to happen, and once it happens, we'll be done. And the second type of team you see a lot of are existing care teams. And this is the type of team I'm personally most interested in. And this is when we're delivering services as a team. So members share responsibility and have to work together to provide whatever type of care is being given. So here, if you want to change a practice that, try to improve patient care in some way, you actually need everybody on that team to participate and change what they're doing to change the quality of care. There are also new care teams. So sometimes we're implementing an innovation that requires people to shift from working as individuals to working as a team. So you can think about something like the patient-centered medical home or collaborative care models where there wasn't a team delivering services and we're trying to build a team that's delivering services. You also see quality improvement teams, which may overlap a lot with implementation support teams, but usually have a broader mission. And then you can also think about multi-team systems. And so this is kind of a team of teams. So you have networks of different teams that are interdependent, meaning they have to rely on one another to reach their shared goals. So each team has an individual team goal, and then the network of teams, that multi-team system, also has a goal. And so this is a very brief overview of what teamwork is in one slide. But when we think about teamwork, I'm using that as a really broad term to think about all the different aspects of what goes into a team. And so we can think about them kind of in three main buckets. So our inputs, our mediators, and our outcomes. So inputs are things about how the team is set up. So things like who's on the team, how big is the team, what's the purpose of the team. Then we have in the middle team functioning. So these are things that teams think, feel, and do. So you can think of this kind of like thinking, feeling, doing at the individual level, except it's at the team level. So what is the team's shared goal? How do they think about the work that needs to be done? Feelings, so things like trust and psychological safety within the team. And then what's the team actually doing? So behavioral processes like communication and conflict resolution. And then our outcomes here are team effectiveness. So this is things like how well is the team really working, right? Like what's the quality of the work that they're producing? How viable is the team? Is this a team that's going to be able to stay together over time? And is it a team that people are benefiting from participating in? So are individual team members learning and growing from their participation in this team? So just briefly laying that out because those are kind of ways that we organize the findings from our systematic review. So thinking about team science, or the science of teams really, and implementation science, let me take in two different questions. The first one is, how does teamwork affect implementation of new practices? The second one is a little bit more exploratory, but the first one is really what guided our systematic review. So that's what I'm going to spend most of our time on, is thinking about how does teamwork influence implementation of new practices. And then at the end, if we have time, I'll share a few ideas related to the second question about how improving teamwork might improve implementation outcomes. So for the methods, I'm going to give a very brief overview of the methods because we published a protocol paper that goes into them in lots of detail, and then also the paper itself is published and has lots of detail on the methods. But I am happy to answer any questions if people want to put those in the chat or ask things along the way. This is the paper. If you want to take a look at it, it looks like Kara also put that in the chat so that you can read that. It has lots of details. Oh no, I moved my mouse to look at the chat. Okay, so basically our overview of our methods, we were looking at qualitative, quantitative, and mixed method studies that were conducted in a healthcare or human service setting that were looking at implementing a new practice to improve patient care. So it was a very broad scope. The studies had to assess at least one team construct, so something related to the team structure, composition, functioning, effectiveness, and describe its influence on implementation processes and outcomes. And before I talked about those different types of implementation, teams and implementation, here we were really just focused on existing care teams. So we were not including any studies of teams that were created to implement the innovation, because we really wanted to see, when you have an existing team, how does the quality of teamwork in that team affect their ability to make change? So for each of our individual studies, we evaluated the quality and the risk of bias. We also rated the relevance to our research question as high, moderate, or low. And then we did a narrative synthesis of studies. And here we only included studies that were at least moderate or highly relevant and moderate or high quality. So we use those two rating systems to decide which studies to include in our synthesis. So let's pause there. Any questions about kind of the background piece or the methods of the systematic review before I go into the findings? Yeah, you can put them in the chat if you think of them. I'll dive into the findings. So our first finding was that implementation science research on teams is increasing. So we cast a really wide net with our search. So we had over 10,000 results. And then we whittled those down very slowly to 55 articles on 58 articles on 55 different studies. Most of them were qualitative, and then a smaller proportion were quantitative and mixed methods, and they were all descriptive observational studies. So no experimental studies here, just lots of studies describing what had happened. And then just to refresh, this is the model that we used to organize our synthesis. So we looked at team inputs, team processes and states, and then team effectiveness. So first, when we sorted those studies, those 58 studies, into what did they actually measure, what was the team construct, about a little under half looked at team inputs. Most of them looked at some sort of team process or state, and very few, only 2, looked at some dimension of team effectiveness. For implementation outcomes, the most common implementation outcome was fidelity, and then the second most common was other. So things were like quality of implementation or the extent of implementation, or things that were just not really very well defined, which I think is probably not surprising to anybody who's kind of seen the literature on implementation grow over time. We were including studies from 2000 to 2022. And so, especially in those earlier years, there just wasn't a lot of guidance on measuring implementation outcomes yet. We also had a large group of studies that were only looking at barriers and facilitators. So initially, our plan was to only include studies that assessed specific implementation outcomes. But then when we actually started doing the search and looking at what we were finding, there just was not really that much. And so to get more out of the review, we expanded this to include studies that talked about teamwork as a barrier facilitator to implementation, even if they didn't measure a specific outcome. This shows the ratings that I mentioned. So we rated quality and relevance, and we included the studies that were in the green here. You can see there's really not, there were only 4 studies that were both high quality and high relevance. So really a lot still needs to happen in this topic. And then there are a lot of studies that were kind of low quality or low relevance. And most of the low relevance ones were things where like a qualitative study where they mentioned teamwork, but it was like half a sentence. There just really wasn't much there. So that made it kind of hard to actually really answer our research question. So we included those 32 studies in our narrative synthesis. For team inputs, we sorted the studies into kind of 4 different topics. So studies that examine team stability or instability and staffing shortages, those that looked at team structure and composition, team interdependence, and then hierarchy and professional roles. For our quantitative studies, there were 5 here, and there was no overlap between the team inputs they looked at and the implementation outcomes they looked at. So for example, you might have like one that looked at hierarchy and adoption, and then you had another one that looked at staffing shortages and fidelity. So that you can actually combine those. For our qualitative studies, we had 15 studies, so a decent number, and we were able to make 4 findings from those. For each of our findings, we use the grades for qual to assess the strength of the overall body of evidence. So that's what this kind of rating in parentheses is, the high, moderate, or low confidence in that finding. So our first finding is that dedicated and stable team members facilitate implementation, while instability in team membership is a barrier to implementation, moderate confidence. Also found that staffing shortages and turnover hinder implementation, high confidence in that one, pretty simple and straightforward. I'm sure you all have seen that in your own work. Our other findings are that team member competency and expertise, experience, and commitment and engagement facilitate implementation. And in multidisciplinary settings, rigid professional roles, hierarchical relationships, and power differentials are barriers to implementation. The next category we looked at was team processes and states. So here we looked at kind of 4 different groups. So one was studies that looked at overall functioning. So they didn't really distinguish between the thinking, feeling, doing parts of teamwork. They just were looking at kind of overall processes and states. Then we had studies that looked at specific affective states, those that looked at specific behavioral processes, and then specific cognitive states. So again, here we had 9 quantitative studies. There was a little bit of overlap, but not enough to actually generate any estimates of effects for any of the implementation outcomes, and the quality of the evidence was very low. So some there, but just really not enough to really make much of. Qualitative studies, we had 12, and we were able to make 2 findings here. So the first is that adaptive team functioning, characterized by positive affective states, effective behavior processes, and shared cognitive states, facilitates implementation and is associated with better implementation outcomes. And the second one is kind of the flip of that: problems in team functioning, including negative affective states, problematic behavioral processes, and a lack of shared cognitive states, act as barriers to implementation and are associated with poor implementation outcomes. High confidence in those findings, but as you might guess, like they're also pretty broad umbrella findings that I don't think are surprising to anybody. So we weren't really able to get more specific in those. When we tried to get more specific, so here we were looking at affective states specifically, we had 3 quantitative studies, and again, no overlap in the states and implementation outcomes that they studied, so we couldn't make any conclusions there. And then we had 4 qualitative studies that looked at affective states, and we were able to make 1 finding. Trust, cohesion, and psychological safety within teams facilitate implementation by contributing to team members' willingness to speak up and share experiences and feedback. Negative affective states, fear of judgment, conflict, and lack of safety hinder implementation, and moderate confidence there. Behavioral processes, again, the quantitative studies, there were a few, but they didn't overlap at all, so we couldn't do anything to synthesize those. We had 7 qualitative studies, and we made 3 findings here. The first is that open, ongoing, and effective communication within teams facilitates implementation of new practices, while poor communication is a barrier. The second is that communication beyond the team facilitates implementation by providing opportunities for team learning, but low confidence here. And then our other findings, also low confidence. Poor coordination among healthcare professionals interferes with providing high quality care and can be a barrier to implementation of new approaches. And then lastly, in this bucket, we were looking at cognitive states. So we had 2 quantitative studies, no overlap, 2 qualitative studies, and 1 finding. So shared goals, mission, and vision within teams facilitate implementation and sustainment. Low confidence here, mostly because it's based on 2 studies. And then team effectiveness, you saw at the beginning that there were only 2 studies that looked at any dimension of team effectiveness. So we weren't able to make any review findings here. So overall, our conclusions from this review were that there were relatively few findings that we were able to make with high confidence. There wasn't enough quantitative data on anything to synthesize. And we found a lot of just issues in how teams were conceptualized, how they were described, assessment of teams and team constructs, the ways that team data was analyzed, and the ways that it was interpreted. So that led us into a lot of kind of recommendations that we could make to improve the quality of this research. But before I get into those, I want to just pause and see if there are any questions about the findings of the review. Right. I can keep going, but if you guys don't come up with questions, this is going to end up being a very short talk. So hopefully you'll have plenty at the end. So recommendations for implementation science researcher teams. I'm going to give recommendations in kind of 5 different domains. The first one is related to how we conceptualize teams. So as I mentioned in the beginning, we've got lots of theories, models, and frameworks. Most of them don't actually say anything about teams. So I think we can do a better job of integrating teams and team constructs into our existing theories, models, and frameworks. I don't think we need any new ones. We can just add what we know about teams into the frameworks we have. And the other thing is that, even though there's not as much research on teamwork and implementation science, there is a ton of research on teamwork generally. So this is not a topic where we're starting from scratch or doing something that's totally new. There are really well established theories of team effectiveness, and we can use those to develop hypotheses about how teamwork will affect implementation. So I think part of how we think about conceptualizing teams is also drawing from other literatures and using their theories to develop hypotheses we can test in our own topic. This is just an example of how we might integrate team constructs into implementation theories, models, and frameworks. So this is from a paper that I wrote with some of the folks on this call, and we looked at how to incorporate teams into the EPIS framework. So we took some of these team constructs that I mentioned, things like team inputs, team processes and states, team effectiveness, and we put them into the implementation logic model. You can also see the implementation strategies box. This I'll talk about a little bit more in the next section of this talk, but this is where we're thinking about ways to target teams and improve teamwork to improve implementation outcomes. If you want to read that paper, here's the link. And that was, I guess, maybe a year and a half ago now, so it feels very recent. But I think that gives a good example of like how we can think about teams in relation to an existing framework, and it also highlights some examples of good high quality research on teams and implementation. The second recommendations are about describing teams. So I think we just read a lot of articles where they said it was a team, and they gave no description of why it was a team or if it actually was. There's a difference between a team and a group of people who work together. So a team really has to rely on one another. There has to be some sort of interdependence. It's not just people who work in the same building or on the same floor. So I think really being clear about if the group is actually a team, and if it's a team, describing what makes it a team. So the structural characteristics of the team, the purpose of the team, the interdependencies. So what are the ways that team members have to rely on one another? Um, Also, when you're doing research on teams, it's really important to describe sampling both within and across teams. So how many teams were sampled? What was the number of teams that were invited to respond that actually did? And within each of those teams, what were the response rates? So a lot of kind of improvement in describing that multi-level sampling. And then related to assessing teams and team constructs, so there's a lot of room for improvement and increasing the specificity and the rigor here. I mentioned that we had a lot of studies where they just kind of mentioned teamwork, or it was, a single item or a couple of, items that somebody had developed on their own. Because there is so much research on teams already, there are actually a lot of reliable, valid measures that can be used if you're interested in measuring teamwork in your setting. So I think that's an easy area for improvement. It's just using the measures that already exist that have been validated in other settings. We also need to do a better job of describing the organizational and the system context of teams. And this again is related to that kind of multi-level research. So teams don't exist in isolation. They work within organizations or across organizations. And even if that's not something that we can always measure quantitatively, depending on the sample size, at least just describing what that context is, I think is really important. And then we also can improve how we analyze our team data. So team data is only team data if it actually is, it can be aggregated to the team level. So individuals within a team might not always agree enough to actually be able to measure something at the team level. So it's really important to look at within team agreement before you assume that something is actually a valid measure of the team, versus just individuals' perceptions of something. And if you want to make team level inferences, you have to actually analyze the data at the team level. And then again, related to this kind of context of teams, if teams are clustered within organizations, it's important to account for that in some way. Ideally, statistically, if you're doing quantitative research with teams, but that's not always possible because we don't always have the sample size. But at least acknowledging the clustering and potential dependencies of teams within an organization. Then our last category is recommendations for how to interpret team data. This really is related to the conceptualization piece. So going back to what is the broader literature on teams? How does it inform, how did it inform our hypotheses? How did our findings fit within that literature? And then what can we use from what we're learning to refine our theories, models, and frameworks to better incorporate teams and to advance our hypotheses? Okay. So questions here, then I'll be on to my last section. Okay, do future directions, and then I will have lots of time for discussion. So the first question I mentioned, right, this question about how does teamwork affect implementation of new practices, that was really the focus of our systematic review. But the second question that comes up for me is if improving teamwork can improve implementation. So I think there are a few different things we can think about when we're trying to think about how we might target teams with our implementation strategies. So in the EPIS paper that I mentioned earlier, we talked about 3 different categories of team-focused implementation strategies. So there are strategies that create teams, strategies that target teams, and strategies that improve teams. So this first category, strategies that create teams, these are just a couple of strategies from the ERIC compilation. If you're creating a new clinical team, you're organizing an implementation team meeting, that's a team-focused strategy because the focus is on kind of creating a new team and to move implementation forward in some way. So that's one type of team-focused strategy. The second set is taking strategies that already exist and just targeting them to the team. So, for example, audit and feedback can be delivered to individuals. It can also be delivered to the team or the organization. But so thinking about different levels, the same way developing disincentives, typically thought about as more of an individual level thing, but you could also target that to the team level. And if you have team level incentives or disincentives, you're creating interdependencies because now people are being evaluated as a team, not as individuals. And so they're now more dependent on each other. So there are ways you can target teams to kind of strengthen interdependencies if that's something you think would improve your implementation outcomes. And then this third category of strategies I think is the most interesting and the most novel. And these are drawing from interventions that already exist that have been shown to improve teamwork. So there's lots of variations, and these are just some kind of example of kind of broader categories of team interventions. Team training really focuses on the knowledge, skills, and abilities that are required for effective teamwork. Team building is more about improving relationships within the team. Team debriefing is encouraging teams to reflect on their own processes, to reflect on their own performance. And team charters is really thinking about how you set up the team. So it's an intervention as you're setting up a team. So those are just some examples of kind of team focused strategies that you could use to try to improve teams and see if that improves your implementation outcomes. So summary, teamwork matter for implementation. We know that they haven't gotten as much attention as some other topics in implementation science, but I think that's increasing. And we are seeing that they do matter for implementation processes and outcomes. We know from lots of different research and lots of different settings that better teams also provide better care. So I think there's potentially a way to improve implementation and improve care by targeting teamwork. So yeah, using all these team focused strategies might help teams better implement new practices. And even if it doesn't help that way, it might still help improve care just by having the direct impact of teams on service quality. So that is all I have for you today. I took up as much time as I possibly could, but I just always talk too fast. That was like 60 slides. So I'll stop sharing and I'll just take questions for a while. Hopefully people have some things to say.
Thank you so much, Elizabeth. I can't believe that was 60 slides. You did it so smoothly. It didn't feel rushed at all.
No, good.
Well, since we do have a good bit of time, it looks like we have opportunity for you to answer some questions in the chat, or if people want to unmute themselves and share their thoughts, you're welcome to.
I'm happy to answer questions or just hear your thoughts.
Well, it looks like Amir might have a question here. Do you want me to read it, or are you able to access it?
Yeah, I can see it. Okay, so insights on how organizational culture and policies impact the development interaction of teams. Very strongly. I think that that is very key because often, not every team is within an organization, but if it is, the organization is deciding how that team is set up, who's on the team, what the team's responsibilities are, how the team's evaluated. So I think that's a very powerful influence in terms of organizational culture. But there's also variation, right? So even teams within the same organization are still going to vary. So if we think about our multi-level framework, right, our organization, and then we have more variability at the team level, and then within teams we have variability at the individual level. So I think it's absolutely something that we have to be thinking about. And then let's see, privacy concerns regarding PHI influence how teams collaborate and interact. Yeah, I think that's actually also related to how teams are structured. So teams within the same organization probably will not have much restriction on kind of sharing of PHI if they're all working in the same organization around the same patients. They're all going to have similar access to PHI. But that's not true for every team. So I actually do some work with teams that are responding to child abuse, and they have very different confidentiality standards. So mental health providers have PHI that they can share without specific releases. Victim advocates have specific confidentiality requirements. Child welfare and law enforcement, totally different. So I think a lot of that goes back to kind of the setup of the team. So thinking about when the team is set up and what its purposes are, and thinking about what information does need to be shared with the team, and identifying processes for effective information sharing. Let's see, resources related to those topics. Nothing specific is coming to mind. I'll keep thinking about it and see if like there's anything specific comes to mind. Yeah, happy to.
I have a question. Thanks for the presentation. I really enjoyed it. I'm trying to translate this to selfishly to kind of my own work. And when the focus isn't on teams, but we have for example, we have wrapped up a adaptation of an evidence-based program in partnership with, I would argue we had community partners, we had state partners, and we had state agency partners who provided input and consultation at key times. So the team may have changed and morphed, or maybe you can tell me I'm using that word team wrong, or the roles they played in each adaptation step changed, and they kind of came in and out at different spots.
Mhm.
I'm curious, when the research isn't focused on teams, I guess one of my questions is, what are those like, if we're measuring nothing about teams, what is like, we should really add in this one to these three things about teams, because they're going to be so fundamental to capture, to influencing the implementation outcomes that we're looking for.
Yeah. So many thoughts here. So I think the idea of like how a team is structured and like what counts as a team is really challenging. Actually, I think this used to be a much more like, oh no, a team is like this very bounded group of people, and everybody knows who's on the team, and like it's very clear. There's no change. But I think that's just not the case anymore. Some more modern conceptualizations of teams really do recognize that there's a lot more fluidity. So if you're looking at like a healthcare team, who's on the healthcare team, right? Is it people in a unit? Is it people caring for a single patient? Is it people who work the same shift or different shifts? And so I think there's a lot more recognition of like the fluidity of teams and how people come in and out. I think the key thing that makes it a team versus kind of just a group that's like collaborating, is that it's how much people really have to depend on each other to get their work done. So if you have a lot of, community partners and like they're giving you input and it's great and you're working well together, but like you also could do it without them, then it's probably not a team, right? Doesn't mean it's not a good partnership or a good collaboration, but they're not dependent on you, you're not dependent on them. But I think a lot of the same things still apply, right? If you think about thinking, feeling, doing in collaboration versus within a specific team, I think there's still the same kind of things about like, why are we doing this? Right? Why are we spending time together? What's the purpose of this? Do we have some sort of shared goal? The affective states. People always wonder, like, how do I build trust? I always actually say, like, start with the behavior, right? So communication, coordination, like information sharing, all of those things are still just as relevant to a collaboration, even if it's wouldn't really count as a team. Um, and I think this is where teams research also starts to like bleed into like social network research. So I think it's an interesting continuum from these like very traditional bounded teams, like teams in the military where you're like, you know, SEAL Team 6 or whatever, like, you have this specific group of people, very clear tasks. They work together all the time. Everybody knows who's on that team. And then you have this continuum where it goes into like, at what point is it just kind of a network of people working in the hospital who form teams, and come in and out of teams. So I think social network analyses also have like some interesting things to tell us about teams.
I do have a follow-up. While there's no other next questions, as we continue to publish the findings, do you have recommendations because you're making me rethink how we're talking about what we did. And we did give a presentation at last year's Society for Prevention Research, but in part because the theme was about team science. And so we framed our presentation related to the theme of team science. And now I'm linking all of these things together, given your talk. You know, do you have recommendations for when we were talking about the methods that we used in our project? What are, you know, do we talk about structure, like, do we talk about some things you've reviewed? We don't necessarily have measures, but how, do you have any suggestions for structure on how best to describe a team to support future work like what you just did?
Yeah. Yeah, so I think this so I always talk about like the science of teams versus team science because I think that gets super confusing. But like the science of teams is like how do we understand how teams work? Team science is like how do we do science as a team? And then there's the science of team science, which is like how do we study, how teams do science as a team. So it gets very confusing, I think, when you start like layering together all of those pieces. So I'm sure that's contributing. But if your goal, I think, is to describe like how your team, like how your research team did good science together, I think thinking about like the structure and composition of your team, like describe like you can think about that model, like the structure and composition, like what are the inputs? How is this team set up? And then like the processes, so communication, coordination, like what are the behavioral things that you have in place? If you have any measures of like affective states or cognitive states or just kind of things you did to try to encourage like healthy adaptive processes and states. And then on the team effectiveness side, you can think about like what did your team produce, right? Like how high quality was the research you did? That's a measure of team effectiveness. Are you continuing to work together as a research team? That's a measure of team effectiveness. Um, does that help?
No, yes, that helps. And thanks for cueing me back to that figure. That's a great point. And it's making me think, are there opportunities to, you know, trying to get the most out of a project, like to talk about the team process in that and get kind of in a scholarly way. So yeah, thank you. This was great.
Yeah, I think if you look into like if you look like the science of team science, if you use that term, you'll find some of the research on doing science as a team, and that might help you kind of give you some frameworks to like to use in how you're presenting your own work.
Thanks.
So, hi, Elizabeth, it's Greg.
Hey.
Yeah. So I'm just wondering, because we're talking about teams, but I think there are lots of situations where people are working together, but we could construe things that weren't considered teams as teams. So, for example, across service sectors or across organizations, just since you're working in that space a lot, just wonder what your thoughts are about opportunities for doing things in a team way versus kind of our usual more scattered approaches.
Yeah. You mean like I guess I have two sets of reflections here. One is like how much of a problem is it when we like call it a team if it's not actually a team? And like do we really need to be more precise or can we kind of just keep calling things a team if we think they should be a team and people should be working together? I don't think there's like a clear answer here. I think that the more we can kind of describe the group of people, then it doesn't matter so much if we call them a team or not. If we can just better describe what they're actually doing, why they're working together, how they're working together, and what they're producing. I think that'll help us kind of a little bit struggle through this, like, are they really a team? Is it just a group piece? And then I think in terms of like what to actually do in those settings when you have these groups of people that you like want to be more of a team, you want them to work more effectively together. Um, I think this is my speculation more than evidence based because as you saw in our systematic review, there's just not great evidence on a lot of this. Um, but I think that I would put more of my effort and attention into the cognitive processes and the shared goals. So why are we doing this and how are we going to do it? So I think if groups of people or teams have a shared vision, they agree on a goal, and they agree on how the work should be done, I think that that goes a really long way. And I know like trust and psychological safety are everybody's like favorite things to talk about, but I think they're actually the hardest because it's, like to use like a therapy example, it's like saying, well, everybody wants to feel happier. So how do we feel happier? And it's like, well, you don't get to just feel happier. But what you can do is, cognitive restructuring and work on your cognitions, or you can do behavioral activation. Um, so I think I would really encourage people to focus on like the behavioral processes. Like you build trust honestly by like doing what you said you were going to do and responding when people ask you a question, and being reliable, and like those behavioral things are much easier to start with. The affective states will emerge over time, but they're not really something you can directly target. So in terms of like improving teamwork and whatever in whatever group, I would focus on the shared purpose, and then on the specific like behavioral processes.
And I mean, even as you're talking, some of those things like, being on the same page and all that fits with some of our outcomes, like emergent states, right? Shared mental models and things like that. So it's well, seems a little circular.
It absolutely is.
Yeah, yeah, part of the challenge.
Yeah. Yeah, that like linear model of like inputs, mediators, outputs, like that's not actually how any of this works. It's just a giant circle, but that's okay. We just have to pick a point to start.
Yep. Thanks.
Sorry.
Mhm.
Also, this is an adjacent question, but I'm wondering about your thoughts of AI tools on teams. So there's, so many of these new kind of data decision tools, diagnostic tools that are being used that are supposed to help, physicians or providers make decisions about care. And sometimes they're forced to be part of a healthcare team or group of people. But there can be apprehension both on the provider side, the patient side. So I guess I'm trying to think through how might those, inanimate objects, they're not people, they can't really be reciprocal in any shared affect or cognitive states. How might they be kind of conceptualized as part of the team or not?
That's a good question. I guess that like I don't think they're really part of a team because they're not, people. But I think it depends on like that interdependency piece. Like, can you do your job without them? Or is it like, no, this is so tightly interwoven that like we as a group really are dependent on the specific interaction of some kind. Um, but yeah, I'm not sure. I'd have to like think more about like some specific examples of how it's being used. Um, I do think there are probably some interesting like AI tools that could be used to measure teams, and especially around these like fluid, sorry, the fluidity of teams and who constitutes a team. And there's some cool work that uses like within healthcare systems using things like badge sensors to see like who walks by who and like who talks to who and how much time do people spend in proximity to one another. Um, to try to get a sense of like teams. So you can use, you could look at EHR records and use AI to maybe like pull out like who are all the different people and at what time points, and like try to form a picture of a team in that way. So I see it more directly relevant on like the measurement side. Um, but it's rapidly becoming very relevant to everything. So I'm sure it will become more part of the team, whether we want it to or not. Other questions?
So now we know everything we need to know about team effectiveness research and implementation. Is that correct?
Yeah, this is it.
Yeah, and I do think we also, and Carrie, you can correct me if I'm wrong, but I think we have other resources. I don't know if we have Sean Burke's presentation for us on Teams archived, or what other resources we might have around this. Putting Kara on the spot right now. So,
Actually,
Hi.
Maddie is volunteering. Hi, Maddie.
Oh,
oh,
yes. Hi. Sorry. I'm Nadi Philippi. I'm the methods core trainee for INSTEP. I'm a PhD student at UCF under Sean Burke and Mark Earhart. And actually, if you guys check out the INSTEP website, we have a full multi-page analysis of team emergent states, team in both affective and cognitive, as well as like all the constructs underneath that, as well as like a full analysis of the Marx et al. Team processes framework. So definitely can take a deep dive into that. And upcoming announcement for for new, spoiler alert, we're working on a team development intervention resource that's going to go on the website. So yeah, definitely check those out. It's quick, easy, and can give you a very wicked download into the team effectiveness space if you're coming from an implementation focus.
Yeah, that sounds great. I'll have to check out all of those. I'm also gonna see if I can. Too many monitors and I keep losing my mouse. I was gonna add just the link for the Teams and Epis paper. So I think this is a really nice kind of like introduction if you're more familiar with the implementation world, if you want to learn a bit more about the team worlds.
Well, thank you so much, Elizabeth. This was a terrific presentation. I think we'll be sending out the slides, and maybe, Kara, we can add some of these resources to our email that we send out to everybody. Going forward, I think we've added to our DISC newsletters an archive of all of our past recordings. So Elizabeth will be including your presentation on that archive as well. Thank you so much, Elizabeth, for spending your afternoon with us. And we'll hope to see many of you next month, March 20th, to hear from Doctors Brooklyn Frizzy and Lau. So with that, take care, everyone. We'll see you soon. Thank you.
Thank you all.